today let's talk about stroke and what are the ways to prevent stroke in patients at high risk of having this condition. As you must be aware, stroke is one of the most leading causes of sudden death or disability in patients above the age of 60. And in India today, we are seeing a rising incidence of stroke. So today I want to talk about preventable ways or any screening methods that can be done to avoid a stroke in patients who are at high risk. So first of all, let's talk about which kind of patients are at high risk. Patients with diabetes, hypertension, a history of smoking, uncontrolled or high blood lipids or cholesterol levels, or what we commonly call as cholesterol, but medically it's more like LDL levels. Apart from these conditions, patients who've had a history of disease in the coronary arteries or the arteries going to the heart are also at a slightly higher risk of having stroke. So are there any preventable ways or ways that we can identify these patients earlier, or these patients can go for screening and therefore avoid a potentially dangerous and avoidable stroke? So these kind of patients who are at higher incidence of stroke, they tend to have some kind of disease in the carotid arteries that go to the brain. There are two carotid arteries, one on the right and one on the left. These carotid arteries are the main blood supply to the brain, along with smaller arteries called vertebral arteries. So these four arteries, two carotid arteries and two vertebral arteries, are the primary blood supply to the brain. So these carotid arteries tend to have formation of plaques in them, commonly seen in these kind of patients who are at higher risk. So the patients at high risk of having the stroke will benefit from having a carotid Doppler screening. So this carotid Doppler is a very simple examination where patients can get an ultrasound scan of the carotid arteries to see if there is any plaque or thrombus, plaque or atheromas, or which is nothing but fat accumulation in the carotid arteries, and this can easily be identified with a simple Doppler scan. And these patients, if they have significant blockage or significant narrowing of a certain percentage, they would benefit with some kind of medical management, or some of these patients might require a stent to the carotid arteries, or some of them might also benefit from a surgery called carotid endarterectomy, which is typically performed by vascular surgeons. And this allows these kind of high risk patients to avoid a stroke, because preserving the brain before something happens is extremely important. The brain is a critical organ where the entire body depends on it for our cognition, for our motor abilities, and all critical abilities are controlled by the brain, and brain tissue is extremely precious. So avoiding or potentially identifying a patient at high risk of stroke when they have these kind of conditions like smoking or diabetes, hypertension, or prior heart attacks. So these kind of patients, when we identify them early and treat them for a preventable stroke, will benefit from a better quality of life, and it helps their longevity. At RIVEA, we have a multidisciplinary team that works on preventing stroke in patients at risk. So to start with, from Doppler screening, and if needed a CT scan, and followed by a treatment using surgery to clear the plaque or block in the carotid artery. So based on the patient and their particular situation, the patient could be directed towards stenting or surgery or medical management. So this kind of multidisciplinary approach allows us to give the best personalized treatment for each patient, and it helps them preserve their quality of life and avoid a stroke potentially. Thank you.